President Trump announcing telehealth services for Medicare beneficiaries in the hopes of minimizing exposure to the COVID-19 for the most vulnerable Americans. Joining us now, Seema Verma, Centers for Medicare and Medicaid Services Administrator. And in terms of the people that may be worried, seniors at home and healthcare providers, this seems like a no-brainer and something that should help immensely. Can you explain exactly what we're talking about in terms of talking to your healthcare providers virtually if you're elderly or vulnerable?
Sure, and this is a part of the larger effort to mitigate the spread of the virus. The White House has put out recommendations, 15 days to slow the spread, and it's all about what every single American can do. And the advice that we're giving to our elderly and those individuals with underlying health conditions, including the elderly, is to stay home. And so we recognize that we need to do our part in helping them. And unfortunately, the Medicare program before usually does not allow telehealth services. Those are very limited, only in rural areas, doctors that have established relationships with their patients and very short visits. And so under the President's leadership, we have extensively expanded the use of telehealth to deal with the coronavirus. Essentially what this means is that America's seniors, 62 million of them that are on the Medicare program, can communicate and have a full visit with their doctor. And this is really important because even our seniors that aren't experiencing coronavirus symptoms, maybe they're just a diabetic or somebody with heart disease that needs to check in with their doctor, they can do that from the safety of their home. They don't have to travel. They don't have to sit in a waiting room. And on the other side, you have folks that may be experiencing symptoms of the coronavirus, fever, flu-like symptoms. And for them, they can communicate with their doctor, avoiding them having to travel, sit in a waiting room, and potentially infect other people. So it is a game changer.
And are there other executive orders that are being considered right now, or everything is now in Congress's hands, do you think? What else would you suggest that you have other suggestions for the President on this, Seema?
Well, the President has shown great leadership, and his emergency declaration has been critical for the healthcare community. This allows CMS to give waivers of a lot of federal rules and red tape that get in the way of providers dealing with their patients in an emergency. So we're allowing emergency rooms to set up alternative test sites so that they can screen patients before they come into the emergency room. We're allowing them to use providers across state lines and to give them more flexibility inside the hospital so they can move patients around. And we're hearing from providers every single day asking us for more flexibility, and because of the President's leadership on the emergency declaration, it allows us to give those providers on the front lines the flexibility they need to focus on patients in an emergency situation.
Administrator Verma, it's Andrew Sorkin here. Great to see you under these terrible circumstances. We're looking at images of people at parties all over the country still going out and doing things around this country. Are you satisfied with what the administration and state-level governments are doing around the country to try to bend this curve?
Well, I appreciate all the efforts that state and local governments are giving and the advice that they are giving, but ultimately it is incumbent on every single American to do their part. Even that millennial generation, I've got teenagers at home, I've got a college student, and I know it's hard for them to stay at home, to not go out with their friends, to not go to big parties, but the reality is if they don't do that, they could be contributing to the spread of the virus. They themselves may not show any symptoms, or they may have mild symptoms, but they could spread that disease to other people that are more vulnerable. The other issue is that we don't want to overwhelm our healthcare system. And so we've got to all work together to flatten the curve and slow the spread of the virus.
Becky?
Administrator Verma, we have seen that these actions have kind of taken place, particularly in areas where there are hotspots, where there are cases. Are these the same recommendations that you're suggesting should be adopted across the entire country at this point?
Well, the White House has put out recommendations for communities, but ultimately it's up to state and local officials to make decisions that are working best for their communities. I think the recommendations that we've put out are backed by CDC, keeping gatherings to less than 10 people, asking people to stay home, to telework, the closing of schools. All of those are very important to slow the spread of the virus. We don't want to end up like Italy. And so it's important that we work together to abide by these guidelines so that we do not spread the virus further and overwhelm our healthcare system.
Seema, in contrast to a face-to-face meeting with your healthcare provider, how much are you really missing by doing it virtually? I know that there's the and they stick the what is that thing, a balsa wood thing, Dan, and they might listen to you with a stethoscope, but you can do almost everything you need to do virtually, can't you? I think that things are going to go this way. I mean, we know there's the house calls are very rare at this point, but when you're in a position like this where you don't want to send a person into a place where there's healthcare providers and other patients, this just seems like, given our technology, that we should be moving this way anyway, but it's perfect for this example.
Yeah, suffice to say it's not going to work in every situation, but what we're trying to do at the federal government under the President's leadership is to give every tool that we can give to our providers on the front lines of this. So, telehealth services will work in some situations. It may not work in others, but I do think this is where the healthcare system is going generally. It's certainly more convenient for patients, but it may not work in every situation.
Zach?
I think we
Becky lost her IFB.
Becky's IFB for now, but Administrator Verma,
which is
go ahead, Joe.
I can hear you. I think I lost you for a second, but I can hear you now.
okay.
Sorry, we're having a little bit of technical difficulty. Becky, can you hear us?
Yeah, I got you. I think the key was just down. Very quick question for you, Administrator. We talked to the head of the Mayo Clinic earlier who talked about the number of ventilators they have. He said it's probably not the best idea to move some of those ventilators because you're waiting to see when this wave continues to move across the country. So instead of giving those ventilators to the areas that are hit hardest right now, some of those hospitals have to hold on to them. How many ventilators does the federal government have, and where are they?
So we do have a stockpile. There's thousands of these ventilators, and the President has been talking to manufacturers to increase the supply of ventilators. And it's not just ventilators, it's really all supplies. It's masks and gowns and a bunch of other things that healthcare providers need when they're on the front lines of this. But the idea is to make sure that we are working towards mitigating the spread. If we all do our part, this will help decrease the numbers and not overwhelm the system so that we get into a situation where we don't have enough equipment.
Where are those thousands of ventilators that the federal government has? Where are they deployed right now, or where are they being stockpiled?
Some of that is classified, but there's a system in place. Essentially, right now providers order equipment through their normal channels, and they can still do that. But if they get into a situation where they don't have enough supplies, they can work with their state government and let them know, and the state makes a request to the federal government, and then they make those supplies available.